As we transition to the next portion of this informative webinar, I need to share this disclaimer. The views and opinions expressed by the guest panelists and/or presenters do not reflect the views or opinions of the Delta Research and Educational Foundation, DREF Research Matters for All of Us, the NIH All of Us Research Program, or any of these organizations' affiliates. And now, as we kick off this event to talk about cervical cancer awareness, I am pleased to present to you our guests. We have two distinguished guests for tonight. Our primary presenter is going to be Dr. Elaine Sharp, OGBYN resident. She is going to provide you with a PowerPoint slide and a presentation about cervical cancer and cervical cancer awareness. And then, because we are partnering with the Top Ladies of Distinction, it was just our luck that the president of the brand new Broward Radiance is none other than Dr. Tadra L. Anderson. She is also an OBGYN and Chief Medical Officer of Memorial Hospital Miramar. I'm going to share with you just further.
So I was first started off talking about what is cervical cancer. So cervical cancer, well, actually, first I want to start off with going over a quick anatomy review. Here is the female reproductive system. If you guys can see my mouse and my pointer here on the screen. So this is the uterus here. This is usually where pregnancy implants and a baby would grow. And at the bottom of the uterus is the cervix. This is where what we're talking about when we're talking about cervical cancer. It is at the end of the vagina. If you're looking from the other way in, this is the outside here. You're looking in, and when you look at it, this is what a normal cervix will look like down here. These are other depictions of what cervical cancer could look like and how it can further spread along. So cervical cancer is one of the most common gynecologic cancers worldwide, and it's the third most common in the United States. It's when the cells of the cervix become abnormal, and these abnormal cells can grow and divide very rapidly, eventually to form a tumor as pictured here. They can also grow deeper into cell layers and eventually spread to other organs if not detected early. We know that cervical cancer is caused by the HPV virus, also known as human papillomavirus. And we screen for cervical cancer with pap smears. So human papillomavirus, or HPV, is the main cause of cervical cancer. It's detected in 99% of cervical cancers. And we know specifically that the high risk types, which are 16 and 18, are detected in over 70% of cervical cancers. So this is why HPV plays a very important role in cervical cancer and its development. We classify different types into high risk and low risk. The most common high risk is 16 and 18, which can, besides causing cancer of the cervix, can also cause cancer of the vagina, the anus, and the penis, and also of the head and neck. The low risk types, which are 6 and 11, are the most common cause of genital warts. HPV is very common. We know that at least 3 in 4 people who have sex will be infected with HPV sometime during their life. But having an HPV infection does not necessarily mean that a person will develop genital warts or cancer. Most people, most infections usually resolve in 1 to 2 years, mostly in younger populations, which is why we don't usually screen young women. We start at the age of 21. If changes do occur in the cervix from HPV, the cells almost always go back to normal. It usually takes about 3 to 7 years for these changes, which we describe as high-grade changes in cervical cells to become cancer. So there's different ways that we describe the changes in pap smears when we're using them for screening. And you can have low-grade changes, you can have high-grade changes, or you could just have some atypical changes, which we don't really know what they mean, and we still follow up with additional screening. So as I said, the low grade we monitor closely, high grade we treat, and these are basically precancerous lesions. So one way to help prevent cervical cancer and also HPV infection is to get the HPV vaccine. It's known as Gardasil, and it covers 9 different strains of HPV. As said in the beginning survey that was done at the beginning of this presentation, there's numerous amount of HPV strains, but the ones that are most researched and the ones that we know have been involved with cancer and genital warts are the ones that's listed here in this vaccine. There used to be a vaccine that only covered 2 and 4, and then the 9-valent vaccine was created, and now this is the main one and almost the only one here in the United States. Is recommended for ages 9 to 14. We recommend at this age because we want to catch the youth before they become sexually active. It is recommended for both young women and young men. You can actually be vaccinated up to the age of 45 if you've never been vaccinated before. This is new recommendations in order to further prevent HPV infection and development of cervical cancer. And we know that it can reduce HPV-related genital warts and cancer by up to 99%. So the goal is to catch someone before they become sexually active with the vaccine. But if you are over the age of 26 and you haven't been sexually active, you can still get the vaccine and have it be beneficial to you. But even if you are sexually active, even if you have been exposed to HPV, you may or may not have been exposed to the HPV that's covered in this vaccine, and still would benefit from getting the vaccine to help reduce your risk of cervical cancer. So some risk factors associated with HPV, but also with cervical cancer, is an early onset of sexual activity and having multiple sexual partners. We know that, since, like I said before, early in the presentation, most people would have been exposed to it because when you have HPV, there's no symptoms. No one knows, and the only way we test is with pap smears. But if you're clearing the infection within a year, then your pap smear can come up negative, or your HPV testing can come up negative, and most people don't know. And if you're having sex with multiple partners, you can pass it along. The earlier onset of sexual activity gives you a longer time of exposure or a longer chance of exposure to the virus. Also, if you're having intercourse with partners who are at high risk for HPV, so if you're having sex with someone who's had multiple partners, then that can also put you at risk. If you are immunocompromised in any way, including with HIV, if you're a smoker, if you're not getting regular screening done, and we know that African American, Hispanic races have been disproportionately affected with HPV and cervical cancer. So unfortunately, being a part of these races are risk factors for the HPV virus and HPV pap smears. We started at the age of 21 because we know before then most women will clear the infection. And from 21 to 30, we screen with just what we call cytology alone, which is the pap smear. So we're just taking a brush. This is the display of this is what it looks like when we do a pap smear. So we place a speculum into the vagina, which exposes the cervix. And this is what it looks like to us. And we use a brush to sweep and take a sample of the superficial layer of the cells. And these get sent to the pathologist and they look at it under the microscope. So I know I feel like most women here have been in this position and had this uncomfortable examination. Unfortunately for us women, our organs are internally, so this is what we have to go through during our health exams, but it's for your best interest. So as I was saying, we do every 3 years with pap smear alone from 21 to 30. And as I've been saying before, and that's just simply because we know that young women will clear HPV infections and without any changes, or if they do, those changes will revert back. Once you reach age 30, we start testing. There's multiple ways we can test. We can continue the cytology alone for 3 years, or we can test for high risk HPV. And those are those ones that I listed before, mainly 16 and 18 every 5 years. Or we can do co-testing, which is cytology and HPV every 5 years. Most commonly, most people will do co-testing, but it's whatever's available at your provider. And we usually stop cervical cancer screening at the age of 65 if you have no history of any abnormal cervical cancer screening or no history of cervical cancer. And you must have at least 3 negative pap tests in a row, and 2 negative HPV. You either have 3 negative pap tests in a row, 2 negative HPV tests in a row, 2 negative co-tests in a row within the past 10 years, and with the most recent test in the past 3 to 5 years. That was a lot of words. So I'll give you an example. If you're 65 and you had 3 tests in the past 10 years with 3 negative pap tests in the past, because you're getting them every 3 years. So you should have at least 3, because that would be 9 years. And it must be within the past 3 years. So if you're 65 and your last one was at 64, 63, then you definitely can stop. But if you only had 2 because you're due for one, then we would recommend you would get one. And as long as everything is normal, we'll stop. So that's just one example. But basically, as long as you meet these criteria, we usually stop at 65 years old. If you do have any history of any cervical cancer screening abnormalities, any pap smear abnormalities, the discussion should be held between you and your provider to decide the best screening modalities for you and when to continue or when to stop. And as far as that normal testing go, there's a wide variety of results you can get from your pap smear screening. And it does not always mean cancer. We can have what we call ASCUS, which is atypical squamous cells of undetermined significance, meaning we see some abnormal changes, but we don't know if those changes are due to the HPV virus or something else. We also can have a low risk or low grade changes, which just has a low potential turn to cancer, or you can have high grade changes, which have a higher risk of converting to cancer. Either way, there's a wide variety of results that can happen from pap smears, and we handle them in different ways, just depending on what the results are. Some of the reasons we can have false results is if the sample may contain too few cells, if there may not be enough abnormal cells for the pathologist to study, if there's an infection or blood, they can hide abnormal cells, which is why sometimes we don't like to perform pap smears during your menstrual cycle, but we can if need be. And also douching or vaginal medications can wash away or dilute abnormal cells. So we ask you to refrain from that before your scheduled pap smear. And based on what the results are, we do follow-up testing, such as colposcopy or excisional procedures. And so I'll just explain to you briefly what colposcopy is. It's basically, it's a special microscope that we use to be able to look at the cervix in greater detail. So if you're HPV positive on your pap smear, or if you have any precancerous lesions that are concerning, then we will take a closer look with the microscope. We apply vinegar to the cervix. I know, really weird vinegar, but that's what helps us to see. And we take a look with this microscope, and if we see any abnormalities, we will take a biopsy. It allows us to get a larger tissue sample to send to the pathologist to be able to determine if these cells are truly abnormal and if they're cancer or precancerous lesions. And based on those results, or even based on your pap smear, we can perform excisional procedures such as a loop electrode excisional procedure, which is called a LEEP, or a cold knife cone biopsy. These procedures can either be done in the office or in the OR, and we take a larger sample of the cervix to be able to remove these precancerous lesions in hope to prevent it progressing to cervical cancer. And these patients are usually followed up closely in 6 months to a year for additional testing to make sure that it is all resolved. So most of the time, there's no signs or symptoms for cervical cancer, just because, like I said, all of our organs are inside. It's hard for us women to know what's going on. But if you have advanced cervical cancer, some signs you may see would be vaginal bleeding after intercourse or in between your periods or after menopause. You may also have watery, bloody vaginal discharge that may be heavy or have a foul smelling odor, or you can have pelvic pain or pain during intercourse. Some of these may occur even without cervical cancer. So don't think if you ever have these things that, oh my gosh, I have cervical cancer, but it's one of the things we will look for if you presented with some of these symptoms. So here are some resources. ACOG, which is the governing body for obstetricians and gynecologists, provides a bunch of resources for patients and information on cervical cancer, HPV vaccine, and they go more into depth of your abnormal cervical cancer screening if you like to have more information. It's a good resource where you know it's trusted information, and it's the resource that we all use as OBGYNs to be able to provide information to our patients. So that was my quick presentation. I would like to open it up for
we have a few questions in the chat, doctor, that I'll read for you and you can answer them.
okay.
Sorry. One question posed was, can men get penile cancer from HPV? And is early detection, is it from pap smears? So early detection is from pap smears. So those two questions. The first question was, can men get penile cancer from HPV?
Yes, they can, but I don't want to go too in depth on the men just because
Okay.
I am specifically for women.
Okay.
But just as yes, they can. It's just the same as women can, because we know this HPV virus can cause it, but it's just more common in women for women to be affected with cervical cancer.
Okay, so another question that I guess would be for women, and I hope I say it right, is the Gardasil shot just one shot or multiple?
It's multiple. So I'm sorry. This is me talking. I went through a little bit fast and I didn't go into detail, so I'm sorry about that. But the Gardasil is actually 2 doses for 9 to 14-year-olds. And if you're older, this is 16 to or 15 to 45-year-old group, then it's 3 doses. That was on it was on my slide, but it's 2 doses if you're 9 to 14, and any older is 3 doses.
Okay, so just to piggyback on that, so HPV is and the question is HPV a sexually transmitted disease that can lead to cancer?
Yes.
Okay, and just to recap, what leads to it is that if you're sexually active and you do not get regular pap smears and it's not detected, then oftentimes that is when it progresses. Would that be correct?
Yes. So I just want to also mention, because I forgot to mention it's in my presentation, is that when you have these low-grade lesions, like I said, it can be the low-grade, high-grade. We know that low-grade lesions rarely progress to cervical cancer. Only 0.1% will progress to cervical cancer in 2 years, 0.3% will progress to cervical cancer in 5 years, and only 1.6 in 10 years. So as you can see, these are very small numbers as far as the progression is to cervical cancer. But when we look at our high-grade lesions, we know that 12% will progress to cervical cancer in 2 years and 70% in 8 years. And so this is why cervical cancer screening is important, because if we catch it in the low-grade stage, we can treat it and remove it before it can progress to cervical cancer. And the reason why, as you said in the polling questions, the reason why we have moved away from screening every year to now every 3 years or every 5 years is because we know that it can take 3 to 7 years for precancerous lesions or even HPV infections to progress to cervical cancer.
Okay, thank you. We have another question. Brittany Brown Brooks, she said that she received an HPV shot when she was younger, but she didn't receive the full vaccine dosage. Would she now need to get 2 more shots now that she is currently 31 years old, or just the 1 shot she missed?
Usually we recommend for you to pretty much start over, and Dr. Anderson, I believe, if she's here, you can correct me if I'm wrong.
I was mouthing that, yes, most recommendations, because it's also a different type. We wouldn't know if you had the Gardasil 2 or 4, and now it's 9. It covers more, so usually you would start over, and that would be a conversation with your OBGYN.
Okay. Now, do you know of any research programs related to cervical cancer, or where women can go to find out about research programs?
I do not, but I can actually get back to you on that information. I do work closely with a gynecologist oncologist here, And I know he can point me in the right direction for that, but I don't know any personally at this time.
Okay, thank you.
A great resource for research programs as well, Janine, is the NIH. So NIH typically will have programs that are listed. And another outstanding resource is the University of Miami. They have ongoing research programs in their women's health division. So that would be another great resource that I would point you towards.
Okay, thank you. And we can put that information in the chat. We have another question. Where would we be able to get the vaccine for youth? Is it through their primary doctor?
Yes. So usually, like for instance, my personal opinion, I actually am vaccinated, and I got vaccinated through my pediatrician, but OBGYNs can provide the vaccination as well.
Okay, and with regards to the vaccination, and I know the presentation was lengthy, but and you gave the age range. So, and we had one young lady who said, should she get it later? So after a certain age, do you suggest that people just go and get it, or really it should only occur in youth, unless it's a circumstance like we just had?
Well, so now it's been approved for up to 45 years old. So up to 45 years of age, we recommend that you get vaccinated if you have not been, even if you have been exposed to HPV. After that, after that, we show that the benefits don't really outweigh the risk at that point. Not necessarily risk with the vaccine, but more so with regular screening and like the vaccine probably wouldn't have much benefit at that point.
Okay, and we have another question. A lot of us do have teenagers. What are the risks attached to getting the HPV vaccine?
There's actually no risk at all. That's why we really recommend it. I know some people are usually scared to get it. The most common things I hear from patients, parents, is that they don't want their teens to think that it's safe and okay to go have sex now that they have this vaccine. And that is not what it means. It's just more so we want to protect them beforehand. And you don't even have to tell them that is to prevent something that's transmitted. You just say, this is a vaccine you need to get. But I mean, just to put in perspective for people who may be thinking about it, you give Hep B vaccines to babies all the time, and that is also a sexually transmitted disease. But because people don't think of it in that way, they're like, okay, give it to my baby. But it's in the same way. But we just trying to catch it before they have sexual activity. But the risk, like the symptoms of a vaccine is like the same with most vaccines. You just may have some site irritation or mild fever and those things, but nothing major from the vaccine.
One of the things I would add, if I may, women who are pregnant should not get HPV vaccine. So that's different than some of the other vaccination recommendations. So if you're pregnant, you should wait and not get the HPV vaccine during pregnancy. And also if you have severe allergies just to medication, so latex allergies, those types of things, those are discussions that you do need to have that's recommended prior to getting HPV vaccination. So that's why it's also important to have these discussions with your doctor or your child's doctor to make sure. But in general, I would agree with Dr. Sharp. There are very minimal risks for getting this vaccination.
Okay, thank you, Dr. Anderson.
Wonderful. Thank you so much for this wonderful presentation. I know that I do have one more question, but before we move with closing remarks from Dr. Anderson and me introducing this wonderful professional that you've already had the pleasure of hearing in addition to Dr. Sharp, we do have Dr. Alicia K. Russi with the Dress All of Us initiative. I'm going to spotlight her and just ask if she has a couple of comments that she would like to make before we go to our closing remarks. Dr. Russi?
Good evening, everyone. Thank you for this very, very informative session. The great energy and synergy in this digital space is amazing. The professional presenter, you were on point, and I really appreciate you. And thank you for sharing your expertise and your lens about cervical cancer. And I just appreciate being in this space with you all. Thank you all. Blessings to you, and continue to do great things in the community. Thank you.
Thank you, Dr. Russi. And you've already seen Dr. Tadra Anderson, but let me just tell you a little bit about her. Dr. Tadra L. Anderson, an Opelika, Florida native. Shout out to Opelika. If you're from Opelika, drop it in the chat. An Opelika, Florida native, is now in her 9th year as the Chief Medical Officer at Memorial Hospital, Miramar, recognized for its outstanding quality, safety, and service. She values the team approach, leads by example, and empowers team members to always do what is right. An honors graduate from Miami Palmetto High School. Okay, South Dade. I went to Killian, so I'm familiar. Palmetto High School, Duke University, and the University of Pennsylvania School of Medicine. This Alpha Omega Alpha Honor Society initiate completed her obstetrics and gynecology training at the Hospital of the University of Pennsylvania. Tadra was honored as a March of Dimes Philadelphia Woman of Distinction for improving the health and wellness of women, children, and infants via successful community outreach programs. And 25 years later, she received the 2021 March of Dimes Woman of Distinction Award for South Florida for invaluable contributions to healthcare and the community at large, especially those most vulnerable. We welcome you, Dr. Tadra Anderson. Let's give our hand clap, show some love. And
Thank you.
Thank you. Before you give your closing remarks, I did have one direct message that came in, and I wanted to, let me go back and find this message from, it was an anonymous question. And the question is, I remember getting a shot recommended by my provider about 14 years ago. What is the update on the 3 shots that was recommended to prevent cervical cancer? Are there any updates in research, and is it still offered?
Okay. I'm not sure exactly to what that was referring in terms of the single shot. I'm going to assume that the person got a single shot of the then HPV vaccine. What we know, as Dr. Sharp eloquently provided, is there's been an evolution of the Gardasil vaccine. And so initially, the initial vaccine had the 2 most high risk, as she mentioned, 16, 18. And then through research, it was expanded to include 4, including those 2 top high risk. And now there are 9. So those, so over time, and it's actually called Gardasil 9 is the new vaccination. The reason for the 3 is because younger kids, the younger you are, the better your system is at clearing HPV. So we know, and I think Dr. Sharp mentioned earlier, when we're younger, our body is much more able to clear that vaccination, the HPV virus. So one of the recommendations for the 3rd shot as we've gotten older is because our cells just don't work as well. Our immune systems don't work as well. And now we also know that there are, as mentioned in the poll initially, hundreds of types of HPV. But these are the ones, the 9 most seen in cancers.
And as a follow-up, the comment was, so if we got 3, then we're free from the updated evolution. Is that the case?
Not necessarily. So if anybody's been following COVID, right? The evolution of COVID, where we started with the initial COVID, then we had the Alpha variant, and now we're Omicron, and there's sure to be more. If you look at the news, there's still ongoing research. And so right now, the recommendation is Gardasil 9. When we first started HPV vaccines, that might have been 30 plus years ago, long time ago in my career. Let me just put it that way. And so we're continuing to study and see what is going on. But just like we went from 2 to 4 to 9, there may be something else that comes out. But we do know, at least for right now, as we heard, the benefit of receiving it after that age of 45. So like for me, I'm 56, I'm out of the loop. I'm not eligible. And even when I was younger, I wasn't eligible because the age range only went up to, initially it was teens and then it was 20. So that too has evolved. And that's one of the important points about research, right? We continue to learn. It's not that we got it wrong before, it's just that our knowledge has changed and evolved.
I'm glad that you made that distinction. I was going to bring that up as it relates to precision health and the importance of us getting so many people involved in this All of Us Matters research program is so that we can get all of this data, all of this health related, and everything plays a part into how we respond to these vaccines and the vaccines that are developed for us. If we know that if you're in the Southwest area or a different part of the country or a different demographic and different genomes, then they're able to create medicines that are made for us. Precision medicine, that's what it's all about. So that's why we're encouraging you to participate.
Absolutely. And Lakeisha, if I just might add on that note, especially for us as African-American women or women of color, Latinas as well, it's research and education is critically important. We are underrepresented, as you mentioned in the earlier part of the presentation, but we do know that our bodies may react differently. We have new information, as you're probably aware, on breast cancer and how Caribbean American women are affected differently in terms of one of the most high-risk types of breast cancer. That too was found through research. So similarly, we encourage our people, our women, to be involved so that we can also be part of the discovery process and help to forward treatment protocols as well as prevention strategies.
Thank you. Thank you. We have one more question that came through. This question, another anonymous question. If you're looking to get pregnant within the next year, is it inadvisable to start the vaccine series?
So I would advise it's definitely a risk-benefit ratio. And I would definitely advise speaking with your healthcare provider, again, precision medicine. With series like this, it's hard to give a cookbook answer. However, there are certain vaccines that are worthwhile to get. Again, because remember, pregnancy is going to be now, even though people say 9 months, it's a 10-month commitment. And you'd want to be able to prevent whatever you can prevent early on before you got pregnant, because you won't be able to take it during pregnancy. So I try to advise from a preconceptual counseling standpoint, everything that can be received safely before pregnancy should be received. And this happens to be one because it's not recommended during pregnancy. So that's always sort of my global recommendation. But there may be mitigating factors, like you've had infertility and now you're at a certain point, so I don't want to give a definite, but that's definitely something to consider because you cannot get this vaccine during pregnancy. Wonderful. So hopefully that made sense.
Yes, that makes a lot of sense. And Dr. Sharp, I really enjoyed what you said about the difference between us giving our babies this vaccine that is related to sexual health and us not wanting to give our teenagers. It really kind of changed my mind and my perspective on that now, being a mother of a young lady and having to make that decision for her in the near future. And I hope that some of those are on here probably have a different perspective as well. So I thank you so much for that presentation. Everyone seemed to love it. Such great information. I know the questions are coming and coming and coming.
So you know what, I'm gonna, if you don't mind, Lakeisha, as I make these closing remarks, I want to include a very important point that Miss Irvin put in there, and I don't want to crucify her first name, but she made a great point that I was going to actually make in my closing remarks. So if I may, which is why some OBGYNs and maybe some primary care physicians as well who do pap smears don't suggest or provide information on the vaccine since up to age 45. So unfortunately, some people are not up to speed in terms of the evolution of medicine. They don't stay up to speed. That's just a known fact. So as a chief medical officer and as obstetrician gynecologist myself, I read every day. I'm glad I have this virtual background, because if you saw what, my stacks and piles, of reading material looks like, but a lot of people are not that conscientious. Unfortunately, they practice the same way that they always have, which is why I always want to stress that you need to make sure that the provider you're seeing is culturally competent to what your needs are. And I'm going to say this, at, at the risk of maybe, making some people a little uncomfortable. That's not a color issue. Cultural competence has nothing to do with color. It has to do with understanding who you are as a person, what your needs are, and how best to meet your needs where you are. And so if you're going to someone for a women's health issue and they don't know the latest about women's health, they are not culturally competent in my eyes. And I'm just going, that's a disclaimer. That's not TLOD. That's not Memorial. That's me. Okay, so I think that's important. And the other point that I was going to make, you have to ensure that when you're speaking with your provider, it is a conversation. It's not them telling you or them, pulling stuff out of you. It's that conversation that's easy to understand. I think you should always be able to, when you have a conversation with your physician, understand exactly what they're saying to you. So if they use a word like Dr. Sharp explained and you didn't understand, you should be able to say, hey, can you explain that to me? I don't understand. If your physician does not allow questions, gather your belongings and step to the left and find somebody else, okay? Because they have to be able to make sure that you're communicating well. You can't communicate, they can't really understand what's going on, or you can't understand. And then there's going to be a breakdown of that communication, and it's not going to be the best treatment for you. So understanding what they're saying. So I like to say, whether it's the read back or talk back. So what I understand you saying, doctor, is this, that, and the other. They should be able to say yes, no, or, I don't know, like Dr. Sharp said earlier, let me get back to you with that information. I don't know is a perfectly fine answer, sometimes the best answer in medicine. And I'm always wary of providers who don't provide that good answer, which is acceptable as long as they follow up. Okay. But also, if you're asking questions and maybe you still don't understand, ask for additional information or resources as was provided, like Dr. Sharp provided, but also bring along a trusted friend or loved one to hear with you. Sometimes we're getting information and it's overwhelming. I mean, that happened to me. I'm an almost 12-year survivor of colon cancer. And I remember the first time I heard that, I was like, and I was in healthcare. I was at University of Miami-Jackson. I was like, wait, what did they say? Like, I couldn't remember, like, 30 seconds later, what my doctor said to me. So when I went to the doctor's office, I took somebody with me. Okay, we all got to hear the same thing and make a plan. The third thing I would say is if you get a concerning diagnosis, don't stick your head in the sand. Treatment early is better than late treatment. Although I tell people, especially since cervical cancer is largely preventable, as you've already heard, if you delay treatment, it's really bad. I'm just going to be honest. It's a horrible way to die. It's horrible for your loved ones. It's just, cancer is, people say cancer sucks, which it really does, but this is a really bad one to have. So it's really crucial that if you think you have symptoms, as you heard from Dr. Sharp, you don't know you have symptoms, whatever, still get checked out, because this is a highly preventable cancer. And early on, there are treatments that do work. One of the things we find, though, in women of color is that because we're taking care of other people, we're caring for whoever we're caring for, we put ourselves on the back burner. And so we present later, or we just are in denial. And so I would encourage us, I'm a person of faith as well. Yes, we want to pray. And yes, we want to get our prayer word people praying with us. Absolutely. But take one of those prayer words with you to the doctor to figure out how to get treated and how they can support you spiritually, because God provided us with that in our armamentarium. So let's not ignore that. Okay. So I want to make sure that we are understanding that. And the last point I want to make that was a part of the poll. Yes, pap smears are not recommended necessarily every year, but that's not universal for everyone. Again, precision medicine, it's individualized. There are certain high-risk groups of patients, those who are maybe HIV positive earlier on, who may need to be screened before the age of 21. There are actually those who may need to be screened more frequently than every 3 years. Those recommendations are screening and they are guidelines. So it's not necessarily wrong if your doctor has been doing it every year, but you should have a conversation about why they're doing it, what they're looking for. The other thing I would say is, just because you don't need a pap smear every year, you still need an annual checkup every year. Okay, so I don't want people to mix those two things up, because at your annual checkup, your doctor might ask you a question. You might have forgotten, like, oh, I had some spotting in between my period after intercourse, or, had a little discharge, something was unusual. But sometimes it helps to have your provider, prompt some of those things that you might bring back to your mind, to say, oh, well, you know what, let me still look at your cervix, which they should be doing anyway, because it's not just about the pap smear. There are other components of that annual women's wellness exam that should still be happening. And again, that's part of cultural competence and staying in tune, because I've heard, even myself, people say, oh, well, you don't need a pap smear every year. Yeah, I know I don't need a pap smear every year, but I need all the other stuff that you're supposed to be doing. And so I want those things because my insurance pays for it. So give it to me and push for it. Don't take no for an answer, especially for those of you who might even be thinking about the HPV vaccine and you're on the more seasoned end of the spectrum. Don't necessarily let somebody tell you no or talk you out of it. You need to be able to explain, oh, I read this or I heard this and Can we talk about that? Or ask the question, why are you not recommending it for me? Those are fair questions. And so I want us to be empowered as we talk about our health. That's an important component. Your attendance here tonight is a huge part of your self-care. And I appreciate and applaud you all for coming. It's also important for the community, but we can't be providers and healthcare givers like most of us as women are without including ourselves in those who need the care. So I appreciate this time to have given these closing remarks. I want to say to Dr. Sharp, absolutely outstanding. I don't think as a fourth year resident, I was ever able to do something like we've heard today. And, God is going to bless you for what you have poured out. So we wish you well, and we'll continue to pray for you. But we also pray that you're going to be one of those continually lifelong learner physicians, and that you're going to be one of the people who's going to push forward and help all of us as we move along in our journey. So it's been my honor and pleasure. Thank you to the Delta Research and Education Foundation, and to all of our top ladies for being in partnership with us today. This has really been a treat for me, and God bless you.
Thank you so much. Let's give them a hand clap, hearts, reactions all over the place. This was amazing and so very helpful. So often we talked about our insurance. We go to the doctor, we don't even know what we're supposed to ask. And they say, well, what are you here for today? All I know is I'm here for my annual exam, whatever that means. And I didn't even know that there's different levels to that exam. There's different things that you can ask for. And it's key for us to start to know that, especially as you have people that are uninsured. So we're paying out of our pocket for our healthcare. We don't know what we can ask for. We are self-employed, or we're on other insurance plans. We don't know exactly what the insurance plan pays for. So it's good to have this knowledge and to feel empowered. Dr. Sharp and Dr. Anderson left me feeling empowered, so that the next time that I go to my doctor, I know that I can ask for certain things, and I have a better idea of what to expect from my healthcare provider. And we can shop around and we can find us the doctor that does match our needs, right? So that's what we're going to do. And as you're doing that, I'm going to ask Serenity or one of our members to please drop the link to our draft in the chat, so that if you want to enroll in the draft program and get involved in this precision medicine movement, please join us. It's a very quick process. You can sit on your couch and go through that process of enrolling in the program, and someone will reach out to you after that. Also, I'm going to ask our TLOD members, if you all want to share your Facebook link or your website link, please feel free to drop that, so that if any of the members that are here or visiting with us, if they want to learn more about your wonderful organization, I am a member of the Southern Pearls chapter. If they want to learn more about your wonderful organization, they can learn about that. And don't forget that they do have their National Day of Service coming up, and they are accepting donations at various locations throughout Miami-Dade and Broward County. And with that, I am going to, oh, somebody started sharing. I don't want them to share. How do I stop sharing? Stop them sharing. I am going to close out this session.
Lakeisha,
Yes.
hi, this is Pastor K. Can I speak?
Yes, yes. I'm so sorry I didn't even see you come back on.
No, I've been on the whole time, but what I wanted to say again, thank you to everybody, to all of our guests tonight. Thank you to Dr. Russi for joining us tonight. I wanted to address one question. A question was asked about research for cervical cancer. That's what all of us is all about. Get involved, engage, enroll in the opportunity. Please go to the link, joinallofus.org/DREF and sign up to be a part of research. Because as you know, most of the research is done on 65-year-old white males, and their bodies look nothing like our bodies. They don't function like our bodies. They don't run like our bodies. They don't have the swag that our bodies have. And so please sign up to be a part of this research so that we can impact how we are treated. Dr. Tadra Anderson, she closed with precision medicine. And so that is what this is about. Now that you have heard the information, you are engaged. Now let's take it a step further and enroll. And please remember to like, share, and follow, or follow, then like and share all of our media platforms as it pertains to draft research matters for all of us. I have to thank the residents for being with us on tonight. Dr. Elaine Sharp, you are a sharp, what I call baby catcher. Thank you so much for being with us on tonight. And somebody put in the chat, they love the fact that you are young. And indeed, a young woman doing great and amazing things. And our prayers are with you, with your hands, that God will bless the work of your hands, and that what's coming is going to be amazing. So thank you all, everybody, for joining us on tonight. Can we give it up for Miss Lakeisha Morris Moreau on tonight, doing a great work. And I saw the Rattlers started putting, stuff in the chat. And so I was waiting for Jackson State to come back with something, because we have some alumni on here. And I tell you, they start getting fired up and,
We let them have it tonight.
Yeah.
We let them have it tonight.
Okay. No, I know Dr. Russi has something. Yeah, from Jackson State, she'll start coming all the way out. But
we let y'all have that. We let y'all have that, Kay.
tonight,
that's all right.
Right?
Tonight only.
Okay.
But we know who the real Sonic Boom of the South is.
I heard you. So thank everybody for joining us tonight. And Lakeisha, give them your next event.
Yes, our next event is going to be on February 26th. We are going to be talking about maternal health, and more specifically, we're going to be talking about mental wellness for mothers in all stages of motherhood. You do not want to miss it. We have a licensed marriage and family therapist that is going to be on with us, and we look forward to another moment of self-care, openness, and talking about precision medicine. And with that, we are going to let you have the rest of your night. We are almost to 8:30, so you all can have dinner. I have to go finish homework. And thank you so much for being with us. For those of you that registered, we do have a newsletter that I send out as a recap of tonight's event, and also to remind you about future events. So please be on the lookout for the DREF Miami newsletter. You all have a wonderful night, and thank you so much again, Dr. Sharp and Dr. Anderson, and the women of Top Ladies of Distinction.
Good night. Thank you. Good night.
Good night, ladies.
Thank you, Dr. Sharp and Dr. Anderson.
Good night.
No problem. It was my pleasure. Good night.
Good night.
Awesome presentations, Dr. Sharp and Dr. Anderson.
Thank you, ladies. And I will definitely be in touch with Dr. Sharp and keep in touch with her.
Oh, that'll be amazing.
Absolutely wonderful.
Hallelujah.
Good night, everyone. Good night.
Good night. Let me stop the recording.